CNA practice test questions and answers.
A resident wants a copy of their medical records. The CNA should A. They make a copy and give it to them. B. Inform them that copies cannot be given. C. Notify the family. D. Provide the record release forms and advise the supervisor. Correct answer. D. Residents have the right to information. A procedure is required to release records and includes consent forms. A resident prefers to spend time alone. The CNA should A. Check in constantly. B. Encourage them to notify staff if needed. C. Notify family. D. Arrange for other residents to join them. Correct answer. B. Residents may choose social involvement. Preferences should be honored when safe. A resident's room is messy and they refuse to clean. The CNA should A. Clean it when they leave. B. Insist everything is put away. C. Explain safety hazards and help relocate items. D. Notify power of attorney. Correct answer. C. Residents may keep belongings unless they pose safety issues. CNAs cannot discard property. Two unmarried residents are cuddling in a common area. The CNA should A. Separate them. B. Escort them to a private room. C. Notify families. D. Allow them to enjoy each other. Correct answer. D. Residents have the right to interact socially unless safety is an issue. A resident prefers nighttime baths but is scheduled in the morning. The CNA should A. Assist as needed. B. Notify supervisor of noncompliance. C. Insist on morning bath. D. Deny help due to rules. Correct answer. A. Residents have the right to choose care routines when safe. A staff member hides a resident's call bell due to frequent use. The CNA should A. Be grateful. B. Give a fake call bell. C. Promise hourly checks. D. Return the bell and report the staff member. Correct answer. D. Removing the call bell endangers the resident and is neglect. Unlabeled pills are found in a resident's nightstand. The CNA should A. Give them water. B. Discard them. C. Leave them alone. D. Notify the nurse. Correct answer. D. CNAs cannot handle medications. Unlabeled meds require nurse evaluation. The CNA knows. A. Sometimes you must yell at residents. B. Residents don't notice when items are moved. C. It's okay to share their secrets with family. D. Residents have the right to privacy and respect. Correct answer. D. Residents have the right to respectful, confidential care. A resident is crying in a common area. The CNA should A. Guide them privately and ask what's wrong. B. Leave them alone. C. Tell them they are disturbing others. D. Call family. Correct answer. A. Confidentiality and emotional support are part of care. Ask to sign a resident's will. The CNA should A. Agree without pay. B. Decline and notify family. C. Arrange case management to assist. D. Get another witness. Correct answer, C. CNAs may not participate in legal matters. A referral is appropriate. A resident reports a family member is stealing money. The CNA should A. Reassure them. B. Call police. C. Notify supervisor or case manager. D. Tell another family member. Correct answer, C. Financial abuse is reportable. A CNA asks for help getting a resident up from the floor, but gives no details. The CNA should A. Help report to supervisor. B. Avoid asking questions. C. Ask later. D. Ask the resident. Correct answer, A. All falls must be reported and documented. A CNA must legally report A. Suspected abuse. B. Residents refusing treatment. C. Smokers. D. Families who don't visit. Correct answer, A. Abuse, neglect, and mistreatment must be reported. A family member gives a resident a pornographic magazine. The CNA should A. Discard it secretly. B. Ask them to keep it in their room. C. Give it to a supervisor. D. Encourage similar content online. Correct answer, B. Residents can keep belongings, but must avoid offending others. A resident says they wish their life would end. The CNA knows. A. Elderly people say this without meaning it. B. Self-harm isn't possible in facilities. C. The resident needs help even if they don't mean it. D. They have the right to harm themselves. Correct answer, C. All self-harm statements must be reported immediately. A resident reports a family member hurt them and wants it kept secret. The CNA should A. Assure them. B. Call police. C. Notify nurse or supervisor. D. Tell another family member. Correct answer, C. Suspected abuse must be reported. A confused resident believes something was taken. The CNA should A. Say it isn't valuable. B. Help look for it. C. Call police. D. Call power of attorney. Correct answer, B. Memory issues require helping search before reporting missing items. A CNA sees a resident's item in another staff member's backpack. The CNA should A. Assume it was a gift. B. Call police. C. Return it secretly. D. Ask the staff member and report if suspicious. Correct answer, D. The situation must be investigated. A resident refuses to eat vegetables. The CNA should A. Sit until they eat some. B. Increase vegetables. C. Notify nurse for nutritional evaluation.
Des demi-desserts.
Correct answer, C. Residents cannot be forced to eat. Concerns must be reported. A resident becomes confused at night and wanders into other rooms. The CNA should A. Request restraints. B. Block paths. C. Request sleeping pills. D. Supervise and provide companionship. Correct answer, D. Residents have the right to be free of restraints unless medically necessary.